The oxygen carrying capacity of blood decreases in option A polycythemia, option B anemia, option C leukemia, option D thrombocytosis. The correct answer is option B anemia. In anemia, hemoglobin levels drop, reducing the carrying capacity of the blood. The next question. During inspiration, the volume of the thoracic cavity. Option A decreases, option B increases, option C remains constant, option D alternates randomly. The correct answer is option B increases. When the diaphragm contracts, thoracic volume increases, lowering pressure and drawing air into the lungs. The next question. Which respiratory disorder is caused by hypersensitivity to allergens? Option A pneumonia, option B asthma, option C tuberculosis, option D pleurisy. The correct answer is option B asthma. Asthma attacks are often triggered by allergens that cause inflammation and narrowing of airways. Next question. The primary stimulus for breathing under normal condition is option A high oxygen level, option B low carbon dioxide level, option C high carbon dioxide level, option D low nitrogen level. The correct answer is high carbon dioxide level. Increased carbon dioxide in the blood stimulates chemoreceptors, signaling the brain to increase breathing rate to expel carbon dioxide. Which of the following occurs during forced expiration? Option A relaxation of intercostal muscles, option B contraction of abdominal muscles, option C contraction of diaphragm, option D expansion of thoracic cavity. The correct answer is option B contraction of abdominal muscles. During forced expiration, abdominal and internal intercostal muscles contract to push air out of the lungs rapidly. Which of the following is a common cause of acute bronchitis? Option A bacterial infection, option B viral infection, option C fungal infection, option D autoimmune reaction. The correct answer is option B viral infection. Most cases of acute bronchitis are caused by viruses such as influenza or rhinovirus, leading to temporary airway inflammation. What is the main function of the respiratory center in the medulla oblongata? Option A regulate digestion, option B control breathing rate and rhythm, option C control body temperature, option D regulate heart rate. The correct answer is option B control breathing rate and rhythm. The medullary respiratory center automatically adjusts the rate and depth of breathing according to body needs. Which of the following is a bacterial infection affecting the lungs? Option A tuberculosis, option B asthma, option C emphysema, option D bronchitis. The correct answer is option A. Tuberculosis. Tuberculosis is caused by Mycobacterium tuberculosis and leads to chronic lung infection and tissue damage. The next question. The main site of gas exchange in the lungs is the option A bronchi, option B bronchioles, option C alveoli, option D pleura. The correct answer is option C alveoli. The alveoli have thin walls and a large surface area that allow efficient exchange of oxygen and carbon dioxide. The next question. In which part of the respiratory tract does the warming and humidifying of air occur? Option A trachea, option B pharynx, option C nasal cavity, option D bronchi. The correct answer is option C nasal cavity. The nasal cavity contains blood vessels and mucous membrane that warm and moisten inhaled air. Next question. Which structure prevent food from entering the respiratory tract? Option A uvula, option B tonsils, option C epiglottis, option D larynx. The correct answer is option C. Epiglottics. The epiglottics act as a flap that closes the glottis during swallowing, preventing food from entering the trachea. Next question. What happens to the diaphragm during inhalation? Option A. It relaxes and moves up. Option B. It contracts and moves down. Option C. It becomes rigid. Option D. It stops moving. The correct answer is option B. It contracts and moves down. During inhalation, diaphragm contracts and moves downwards, increasing thoracic volume and drawing air into the lungs. Which type of respiration occurs within the mitochondria of cells? Option A pulmonary respiration, option B internal respiration, option C cellular respiration, option D external respiration. The correct answer is option C cellular respiration. Cellular respiration occurs in mitochondria where oxygen is used to produce ATP and carbon dioxide as byproduct. Next question. The partial pressure of oxygen in arterial blood is approximately option A 20 mm of Hg, option B 40 mm of Hg, option C 60 mm of Hg, option D 100 mm of Hg. The correct answer is option D 100 mm of Hg. Arterial blood normally has high partial pressure of oxygen around 100 mm of Hg, ensuring adequate oxygen supply to the tissues. The main function of surfactant in the lungs is to option A transport oxygen, option B reduce surface tension, option C increase lung pressure, option D absorb carbon dioxide. The correct answer is option B, reduce surface tension. Surfactant reduces alveolar surface tension, preventing collapse and helping maintain lung expansion. Which part of the respiratory system serve as a voice box? Option A, pharynx. Option B, larynx. Option C, trachea. Option D, bronchus. The correct answer is option B, larynx. The larynx contains vocal cords that vibrate to produce sound, making it the voice box. The next question. Which condition is characterized by destruction of alveolar walls? Option A, asthma. Option B, emphysema. Option C, bronchitis. Option D, tuberculosis. The correct answer is option B, emphysema. Emphysema involves damage to alveolar walls, reducing surface area for gas exchange and causing breathlessness. The next question. What is the normal respiratory rate for a healthy adult at rest? Option A, 8 to 10 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 20 to 30 breaths per minute. Option D, 30 to 40 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. A normal adult breathes 12 to 20 times per minute at rest, maintaining proper oxygen and carbon dioxide levels. The trachea divides into two branches called option A, alveoli, option B, bronchi, option C, bronchioles, option D, pleura. The correct answer is option B, bronchi. The trachea bifurcates into the right and left bronchi, each entering one lung for further branching. The next question. Which condition involves inflammation of the pleura? Option A, pneumonia. Option B, bronchitis. Option C, pleurisy. Option D, asthma. The correct answer is option C, pleurisy. Pleurisy is the inflammation of the pleural membranes, often causing sharp chest pain during breathing. The total lung capacity in an adult male is approximately option A, 3000 ml, option B, 4000 ml, option C, 6000 ml, option D, 8000 ml. The correct answer is option C, 6000 ml. Total lung capacity is the sum of all lung volumes, around 6 liters in healthy adults. Next question. Which chemical in the blood stimulates an increase in respiration rate? Option A, oxygen. Option B, carbon dioxide. Option C, nitrogen. Option D, hydrogen. The correct answer is option B, carbon dioxide. Elevated carbon dioxide levels low blood pH, stimulating chemoreceptors to increase the rate of breathing. Which structure serve as a common passage for both food and air? Option A, nasal cavity. Option B, pharynx. Option C, larynx. Option D, trachea. The correct answer is option B, pharynx. The pharynx function has a shared pathway for both the respiratory and digestive systems. The next question. The term dyspnea refers to option A, cough with sputum. Option B, difficulty in breathing. Option C, rapid breathing. Option D, shallow breathing. The correct answer is option B, difficulty in breathing. Dyspnea is a medical term for shortness or difficulty in breathing, often seen in respiratory disorders. The next question. The respiratory membrane consists of option A, alveolar wall, capillary wall, and basement membrane. Option B, bronchial wall only. Option C, pleural membrane only. Option D, ciliated epithelial cells. The correct answer is option A, alveolar wall, capillary wall, and basement membrane. The respiratory membrane facilitates gas exchange and consists of thin layers separating air in alveoli from blood in capillary.